Hello everyone. We have a 36-year-old male brought to emergency due to confusion, nausea and decreased arousal. Okay. Well, he's not able to answer the question. No other history is available. pH 7.21, it is definitely acidic. O2 is normal, CO2 is reduced, sodium, potassium normal, chloride are normal. Bicarb is reduced, BU and creatine are almost in the normal range. Most likely primary acid-base disorder in this patient is. Well, if you look into this, answer is anion gap metabolic acidosis. How can you say? pH is less than 3.5, this is acidic pH, and bicarb reduced, this is a case of metabolic acidosis. We have confirmed. But anion gap, how we calculate anion gap? Sodium minus bicarb plus chloride. Sodium is 140, bicarb is 12, and chloride is 90. So the anion gap here is 38. Normal anion gap is 6 to 12. So anion gap is also increased. So we are clear that why the answer is B. Okay. Now a little bit more about anion gap. Increased anion gap indicate presence of non-chloride containing acid which can be inorganic like phosphate, sulfate. It could be organic like ketoacidosis or lactate, exogenous salicylate, ingested toxin with organic production like methanol. Now the common causes of anion gap metabolic acidosis and with their corresponding unmeasured anion that compose anion gap. Lactic acidosis due to lactate, ketoacidosis due to beta-hydroxybutyrate or acetoacetic, they're all ketones. Methanol formaldehyde, this is formic acid ingestion. Ethylene glycol ingestion, glycolic or oxalic acid. Salicylate poisoning, salicylate, lactic and sulfuric acid, but mainly salicylic. Uremia, impaired excretion of H ion. Well, we are clear about it. Let's look into other option. So, non-anion gap, ruled out, anion gap is there. Is a metabolic alkalosis? No way. Bicarb is reduced. So, this cannot be alkalosis. Respiratory alkalosis, CO2 is normal. But pH is reduced. pH is less than 7.35. So, this cannot be. And respiratory acidosis, CO2 is just 28. So this cannot be respiratory acidosis. So other options are also ruled out. Golden line to remember, anion gap represents the concentration of unmeasured serum anion. In anion gap metabolic acidosis, the anion gap is increased by abnormal presence of non-chlorinated acid in the serum like lactate, phosphate, sulfate. Thank you very much.